Let's turn now to Dr. Elliot Tenpenny. Dr. Tenpenny is in charge of the COVID response team here with Samaritan's Purse. These, of course, are the folks who managed to set up a remarkable makeshift hospital in just 48 hours. Give us the latest numbers, Dr. Tenpenny. Let's start with where we are in terms of the number of folks that you have right now in those tents behind me.
Absolutely. Here in Central Park, we have our hospital built in partnership with Mount Sinai. We have around 40 patients with 3 right now in the ICU, taking more patients all the time to help people in New York City.
And as I understand it, when the day starts, you guys get a pretty good sense of the number of patients that you're going to have to see throughout the course of the day. Is that how it works?
That's absolutely right. In partnership with Mount Sinai, we're accepting patients, and each day a certain number come through, and we receive them throughout the day.
And the lion's share of the patients so far coming from Brooklyn, coming from Queens?
That's right. So the challenge is those 2 hospitals, those 2 boroughs are really the ones that have been hit the hardest early on in this pandemic in New York City. Brooklyn and Queens. And we've been able to serve a great function here by offloading them and allowing them to treat more people.
And there are only 2 facilities, as I understand it, so far like this, the one in Central Park and the one in Italy, correct?
That's right. So there's a hospital exactly like this in Cremona, Italy, that Samaritan's Purse is running. It's the first time Samaritan's Purse as an organization has ever had 2 field hospitals simultaneously in the world.
I did not know that. The staff here, how large is the staff? What are they capable of doing in these tents?
Absolutely. So we have a 68-bed facility here. We have a little bit over 70 medical staff here, doctors, nurses, ICU specialists. We're able to take 10 ICU patients, full ventilators, full intensive care.
Any idea how many patients you guys are going to be seeing today?
I think there's about 10 more coming today.
And what's the hope in terms of folks who are able to leave today? Do we know?
We're looking to discharge 2 or 3 today. There were 5 discharged yesterday. We're very excited about it. Those are the first 5 patients that have been able to be discharged.
There continues to be this misconception that the lion's share of people who are afflicted by this virus are older Americans who have underlying health conditions. I understand that you've had someone here as young as 20.
Now, this virus doesn't just attack older Americans. They're at greater risk for severe cases, but you and I are wearing masks right now for a reason, because this virus doesn't care who you are. It doesn't care how old you are. It's attacking people of all ages.
I'm struck as I look at this small tent city, how quiet it is. It's very quiet.
Absolutely.
How many people are working in there right now?
About 60 people are in there right now, working in their various jobs. You know, at Samaritan's Purse, we try to make these as close to an actual brick and mortar hospital as possible. Years and years of planning go into this to be able to do that. Part of that is what you're hearing right now, because patients are living right now, day to day, doing their day-to-day activities right inside those tents. So we have to be quiet. We have to take into account what they need in everything that we do.
How long do they typically stay here?
Well, we've only been open, 3 or 4 days. But if our patients in Italy are any indication, they could be here weeks, 2 to 3 weeks even, the sicker patients.
Thank you.
Thank you.
Thanks for what you're doing here, by the way. Certainly God's work, Dr. Tenpenny.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.